Hi, I'm Dr. Swathi Leroy-Akun. I'm a vascular neurologist, and I want to talk to you about strokes. I'm making this channel very intentionally because I love what I do. I love my patients, and I wish there was just more stroke education out there. So I thought I would do it, and hopefully it helps someone in need. I want to start off by thanking you for tuning into this video. I chose the end of April, beginning of May as the cornerstone of starting this channel because May is actually Stroke Awareness Month. And we're going to get down to the nitty gritty, but really the basics because it should be easy for anyone to understand. An 85-year-old or a 10-year-old. That's my goal. So let's talk about it. Why are strokes so important? And why did we dedicate a whole month to the awareness of strokes? Well, strokes are important because they are a leading cause of disability globally and in the United States. They're the number five cause of death. They are the fifth leading cause of death in the United States. In addition, by the time we're 65, 1 out of every 4 of us, our friends, think about it. If you're in a group of 4 close friends, one of you will have your life impacted by stroke. And we don't know to what degree. And I will go into that a little bit later because strokes come in many different flavors and they impact each person differently. I just want to start off with the basics and also say that there's 2 major types of stroke. So most strokes are caused by lack of blood flow. So blood's not flowing to the brain like it should. It's usually due to a plumbing issue, due to a clot that forms either in the blood vessel, right, in that pipe, or it could be due to a clot that forms somewhere else and then goes upstream to that pipe and blocks it. Sometimes, if we've had too many burgers in our life, too much cholesterol, that cholesterol likes to hang on to that wall of the artery, and it starts slowly over time causing plaque buildup as well and narrowing of those arteries. Other risk factors for that, also include smoking and diabetes, all these things that can lead up to stroke. So there's different causes for even just that one main type of stroke. So you have strokes caused by lack of blood flow. Those are called ischemic strokes. And then we have the other big group, and they occur in about 15% of patients. So those are called hemorrhagic stroke. Ischemic strokes occur in about 85% of patients, and hemorrhagic strokes occur in about 15-ish% of patients. Now, a hemorrhagic stroke's really scary too because it's due to a rupture of a blood vessel, and so that's a brain bleed. We're not going to know whether you're having a brain bleed or you're having the more common type of stroke when you come into the ER. And one of the biggest things that makes me cringe as a physician, more notably as a vascular neurologist, is that I have patients that think that they should take a bunch of aspirin before coming into the hospital because we're taught if you're having heart attack symptoms, right, you should take an aspirin. It's going to help get blood flow to your heart. But it's actually dangerous if you're having a stroke because we don't know if the stroke is caused by brain bleed or blood clot. And if you're having the brain bleed, thinning your blood with aspirin is just going to make it worse. And so that's probably one of the top things that I educate my patients on when they tell me that they're coming in and they've already taken 5 aspirin. Don't do it. One of the other big things I want to educate on in this first video is if you or a loved one are having stroke symptoms, please, please, please get into the ER emergency room right away. Do not go to urgent care. It is going to delay your care because then they will just transfer you. 100% guaranteed they will transfer you to the ER, and that's going to delay care. Why is that important? It's important for the same reason of going to the hospital anyways, and that's because for every minute you're having a stroke, 1.9 million neurons are dying in your brain. That's a lot. And if we can try to save your brain cells, that will eventually mean that we're giving you a better chance at recovery. That's super important. And when you come in within a certain amount of time, right now, our trials have indicated for sure 4.5 hours. If you come in within 4.5 hours, we can offer you a very strong clot busting drug to help save that brain and bust up that clot. But first, when you come into the ER, there's gonna be a lot of people around you, a lot of ruckus and chaos. One of the biggest things we have to do, because we don't know if you're having a brain bleed or you're having a stroke caused by clot, is we have to get a CT of your brain. That's gonna tell us. Once we've ruled out the actual brain bleed, then we'll be in the clear to give you the clot busting drug. We always want to give it with your consent and your approval, and that's another big thing. Don't wait. Please don't wait to come in at 4 hours and 10 minutes after your symptoms started. Why? For the same reason that I said before. For every minute we're not able to intervene while that stroke is happening, you're losing almost 2 million neurons a minute. So if we are able to give it to you within an hour, that's a lot more brain saved. I hope you enjoyed this little public service announcement by me. I'm hoping to do more videos, but I just wanted to start off as a little hurrah for May, as it's going to be Stroke Awareness Month, on some of the biggest facts about stroke and what they are and why it's super, super important to go to the ER immediately. Thank you.